Facial injectable treatments have become a bigger part of facial plastic surgery practice here at the Aesthetic Center of Woodholme, as well as everywhere. There are two main kinds. There are the neuromodulators like Botox and Dysport, which immobilize muscle and reduce wrinkles in the face. And there are fillers, which add volume to specific areas in the face, and they treat lines and wrinkles. And also if you have sunken cheeks, things like that, that's what fillers do.
Botox is a procedure that weakens muscle movement, and that improves wrinkles. So we use it obviously for the 11 lines here. We can use it for the horizontal forehead lines, for the crow's feet. We can even use it to turn the corners of the mouth up or improve the banding of the neck muscles. Results usually last about 3 months.
Like all procedures, Botox has some risk. You can get some bruising, some swelling, and in the upper face you can get a lazy eye or some drooping of the eyelid, which is temporary and gets better fairly quickly. There are no permanent complications of Botox.
Facial fillers are products that we use to improve the volume in the face. Studies have shown that as we age, we lose that volume, so replacing that volume makes us look better.
Facial fillers can be used for many different purposes. They can be used to augment volume and correct wrinkles in that way. They can be used to make the chin or jawline more defined, for example, or they can be used to change the shape of the nose.
With the many types of fillers, they do last different times. Most are hyaluronic acid fillers, and they last anywhere from 6 to 18 months, depending upon where they're used and which type is used. There are others that are made from calcium, and they can last about a year. And there are permanent fillers, which we use sparingly and only in certain places, where those can last 5 to 10 years at least, and probably longer.
Facial fillers have risks, and that is something that a lot of patients don't realize. They think that Botox is dangerous and fillers are safe, and it's the other way around. Facial fillers can be injected into a blood vessel inadvertently, which can injure the skin that is fed by those blood vessels. It can also swell and cause lumps, and actually be very dangerous if not used by a skilled injector. After an injectable treatment, patients may have a little soreness and they may be bruised, but usually that goes away within a few days.
Most people don't have it, but it can happen. Preventative measures include applying ice, taking some herbal remedies beforehand, and of course, good injection technique helps as well. And if it does occur, ice, elevation, and a few days are usually all it takes.
We also recommend a rapid recovery kit, which contains arnica and bromelain, which have both been shown to reduce bruising after these types of procedures.
After an injectable treatment, a patient can expect to see results depending upon what we use. For the Botox type products, that we know takes 5 to 7 days to get a full effect. And it's a little frustrating, but you get there. Fillers, you get a more immediate change. You can see it right away as soon as the injection's done. There may be a little puffiness, there may be a little firmness, but that goes away in a few days.